Welcome to another episode of What Rubbish, a holistic treatment to holistic approach and treatment to breast cancer. Today we have a nice panel expert on nutrition, exercise, and exercise physiology, and we're gonna harp on more importantly on the benefits of proper nutrition, exercise, and the holistic care. And with that, with us today, we have some distinguished folks who are representing, and they will basically introduce themselves. So I think we'll probably go through the introduction. Myself, I'm the founder and the host of this episode, the Alka Ohri Foundation, and I'm excited about bringing this knowledge and expertise to the not expertise, but more so the knowledge to the audience who are listening to us, especially the women with breast cancer. And with that, I'd like to have one of you introduce yourself, maybe Kylie or Cara. Go ahead.
I'm happy to start. My name is Cara Anselmo. I'm a registered dietitian nutritionist, and I've been with MSK for, 18 years now.
Wow.
I work mostly with people who have breast cancer, who are living with breast cancer or have had a history of breast cancer. And I work within the Healthy Living program, and I really see a wide variety of patients at all different stages in treatment. And I'm sure we'll talk about that some more.
Of course. Yeah. Kylie?
Hi, thank you for having me. My name is Kylie Rowed. I'm the exercise physiologist with the Healthy Living program at MSK. I have also been at MSK for a while now, going on 9 years, and specifically with the Healthy Living program, working with breast cancer patients for the last 5 years.
Oh, fantastic. And Margaret, you can also introduce yourself, of course.
I'm Margaret O'Connor. I'm the Corporate and Foundation Relations Officer at MSK, and happy to be here.
Okay, well, thank you for joining us. So we'll kickstart right away. And I think my most important question is based on the activities that MSK is doing specifically to integrate and promote these holistic practices. So can you talk about what is the functionality of your group specific in terms of providing a better treatment plan? And I think maybe Cara, you can start with this question, and then Kylie, you can talk about it.
Sure. So I think one of the things that we are aiming to do with this program is start seeing patients who are living with cancer as soon as possible in their treatment journey so that we can provide resources like nutrition and exercise and anything else that they might need along the way. As far as nutrition, I'm happy to talk more about the services that I provide, but again, I work with people at all stages of treatment. I work with people who are post-treatment and pre-treatment and in the midst of different treatments on nutrition and really maximizing nutrition for their quality of life to enhance treatment outcomes, and so that they are benefiting as a whole person. So we're not looking at this as a quote unquote cancer patient. This is an individual, and part of them is someone who's living with cancer. So we're really addressing that whole person.
I think one of the things that we see is when the patient gets a cancer and they come to you, that's the obvious. But then the other part is that the patient has a family history of cancer, but they don't see you, especially the women who is not having the cancer. So they don't see you. So I think that's the audience also we are addressing. And I think it's important from your perspective, being, you eat what you are, you become what you eat, right? So I think from that point of view, what are the guidance that you are providing right now, or what message can you provide to the audience that some of the precautions that they need to take? Because nutrition is a very wide subject.
Sure.
And of course, we also realize that it is directly proportional to each individual. Every individual is different. So what would be your generic guideline per se? Maybe generic is the wrong word, but what would be your basic guideline? I would say I would request that you can suggest.
Sure, sure. So it sounds like you're talking about the context of risk reduction. And I do work with individuals outside of the scope of this program who may be at high risk due to gene mutations or family history,
Yeah.
but who have not had a diagnosis. So we're really targeting risk reduction. And I don't like to use the term prevention because we can't, with 100% certainty, prevent cancer at this stage at least, but we can reduce risk. And we know that there are lots of lifestyle measures that can help minimize risk for developing cancer or for cancer recurrence. So some of the diet suggestions that I would make globally, again, keeping in mind any individual is going to have different tolerances and needs. But
that's where the questions will come. That's where the questions will come.
So choosing a diet that is plant forward. Now that doesn't have to be vegetarian or vegan per se, but it's a diet that is abundant in whole plant foods, vegetables, fruits, beans, whole grains, olive oil. Often called a Mediterranean style diet, but doesn't necessarily have to culturally reflect a Mediterranean style diet. We talk about minimizing foods like red meats and avoiding foods like processed meats in line with the guidelines from the American Institute for Cancer Research. We do recommend minimizing or avoiding alcohol. We know that alcohol is related to many different types of cancer, including breast cancer. And minimizing foods like refined carbohydrates, added sugars. These are not necessarily things that are directly linked with a breast cancer diagnosis, but they can help contribute to a healthier diet quality, minimizing those kinds of foods, and overall produce a individual who is living in a body that has a metabolic milieu that is more likely to be able to fight cancer, if you will, and less likely to develop disease. So those are all some risk reduction strategies.
That's a good insight that you provided. Is your advice tailored to individuals' needs and varies from treatment stages? Now, obviously, if a stage 1 cancer comes in and stage 2 cancer comes in and stage 3, what is the variation of the diet in that?
Absolutely.
Maybe you can shed some light on that.
Yeah, that's such a great question. And I'm so glad that you bring it up because someone who's looking more at an early stage breast cancer, and maybe they, really are focusing more on big picture healthy eating. Maybe they're even looking towards changing body composition, reducing some excess body fat. That might be a very different situation than someone who has more advanced stage disease and is undergoing a treatment that's causing acute side effects. So individual who might be experiencing severe loss of appetite, someone who might be experiencing anorexia, someone who might be experiencing diarrhea, all things that can really contribute to less intake. So, the first patient I mentioned, we might be talking about, being more careful at which foods to limit, which foods to stay away from. And the latter patient might be someone who we're really looking at how do we maximize what they're able to tolerate and what they're able to eat at this point. How do we liberalize their diet? Are there things that they're avoiding that they don't have to avoid? So those could be two very, very different clinical situations and individuals.
So, Cara, one of the concerns that I experienced when my Alka was going through the disease treatment at that time, and she was treated at MSK, and the treatment, the doctor was phenomenal. But I think one of the challenges that we faced was there was no customized nutrition education. It was basically a PDF sheet that was provided. Well, watch this, watch this, watch this. But being these patients are life-threatening diseases, suffering from the life-threatening diseases, are you doing anything different rather than giving them a menu-driven diet that they need to avoid? Or do you customize their diet? Do you work one-on-one and provide them a customized diet that they can follow? Because every patient is different.
Of course. And that's why I don't hand out a diet. We do have written resources that we offer for a wide population for people who are looking to reduce risk as well as people who are living with disease. But instead of handing someone a form and saying, eat this, this, and this, what I would much rather do is sit down with someone and talk to them. What does their diet look like right now? What are their side effects, if any? What are their other medical concerns? Are they also living with other conditions that they need to manage? What is their budget? What does their lifestyle look like? What are their preferences? What do they enjoy eating? Do they have any religious or cultural concerns that affect what they're eating? So we're really going to look at all of these pieces of the puzzle when we're sort of crafting the best possible nutrition plan for someone.
Okay. But I think a lot of these women who come, I wouldn't say they are clueless, but majority of them, they don't know what they like and what they don't like. Maybe that's a iffy statement, but what I'm talking about is that they don't know what they should be eating that's going to affect negatively or positively. So they come for guidance to expert like yourself. What do you do in that regards?
Well, I think that's where we really talk about, a framework of through evidence-based medicine, what best practices are, and again, tailor that towards someone. So I may have someone, for example, who is on a treatment that causes severe dysgeusia, which is just changes in taste, right?
Yeah,
and they might outright tell me, I cannot eat chicken or meat or fish right now. It tastes terrible. So I think that most of the people who I meet with do have very definite preferences and tolerances. Okay. So in that setting, it might be about what are some other great protein sources that are important so that you don't lose lean body mass during your treatment. Another example might be someone who tells me, I don't really like vegetables. And we talk about what kinds of vegetables are out there and different preparation techniques and ways to make them more accessible and enjoyable. So, again, it really does come down to that individual. So we're looking at a framework of evidence-based medicine based on the literature, sort of definitely data-driven, right. But also, what does this person sitting in front of you want and need at the time?
So in the healthy living program that you are working with, of course, you have got a vast group of patients, and you have probably come up with some kind of a statistics, or I would say some kind of a data, which kind of tells you what is known, what is good, and what is not good.
Good and not good as far as
in terms of the food. I mean, in terms of the nutrition.
Yeah, so again, we rely on the literature that is available on nutrition and cancer. We look at guidelines from organizations like the American Institute for Cancer Research, ESCO, the World Cancer Research Fund. So again, our practice is data-driven in that regard. We do, clinical trials here at MSK. I'm probably not the best person to speak on that, but that is part of what we do as an institution, certainly. Right.
So are there any, do you do any webinars or some kind of what are the education mode or media that you are trying to do, or maybe provide some kind of a information to the patient that they can go and access that?
Sure. So just in terms of individual counseling first, we do in-person, on-site. We also do telehealth, and we do phone. So those are all options for patients as individuals and for their family members. I do certain group presentations and webinars. For example, I work with MSK on webinars on healthy eating. I present to professional audiences as well. For example,
oh, really? Okay.
Yeah, last year I presented at the Academy of Nutrition and Dietetics annual conference to a large group of people in the field. So here at MSK, I often present to other providers that then can take that knowledge and help use that to offer care to their patients. So even if the patient is not seeing me directly, that knowledge gets imparted. Okay. So a variety of different types of group programming like that.
Okay. Well, thank you so much. I think now I can talk to Kylie about the exercise piece. That's also a very important piece. I hear a lot of good stuff which has a direct impact on cancer when women does exercise. So maybe Kylie, you can talk about your experience and your knowledge about what are some of the things that you're recommending or suggesting to these women.
Yeah, absolutely. So similar to what Cara was saying about it being very evidence-based. So we're actually lucky at MSK. We have a great research program that is separate from the Healthy Living program, run by a few researchers called the Exercise Oncology Research Program.
Okay.
And so they do a lot of research on breast cancer patients and various other, lung, prostate, and they have helped to kind of come up with the exercise guidelines. So they're not only doing research on cardiovascular outcomes from exercise, but also they're starting to look at tumor biology and the impact exercise has on tumor biology. So that's kind of a newer field as well.
Nice.
So what I am trying to do in the Healthy Living program is basically translate that research into clinical practice. So we aim for the guidelines. So that's kind of our overarching, goal from the American Cancer Society. So broken into 3 main types of exercise. So we have aerobic exercise. So things like running, biking, elliptical, any of those modes of exercise that are going to elevate your heart rate and breathing rate for an extended period of time.
Okay.
And then we have resistance or strength exercise. So, your classic type of exercise at the gym using weights or machines or even body weight exercises at home. And then flexibility. So working on range of motion, stretching, just in general, but especially for women with breast cancer or into survivorship who may have had surgeries and have restrictions or limitations from those surgeries or radiation.
So there are a couple of patients actually within our family and friends. They just got detected with breast cancer, stage 1. One is triple negative and one is stage 1 breast cancer, HER2 positive. What sort of recommendation you would provide to these women who are at stage 1? What type of exercise recommendation that you would provide for to do any performing the physical activity? Maybe you can shed some light.
Yeah. So first I would, counsel them on the recommendations, but more importantly, I would want it to be personalized because like Cara said, they might have, various other health conditions that, if I'm telling them to do a lunge or a squat, they might just not physically be able to. So there's other ways we can modify that. So, letting them know what the recommendations are, but then also taking into consideration what their treatment plan is. So if a patient, even with stage 1 or stage 3, if they're going through certain types of chemotherapy, in that situation, they might have one good week and one bad week. So I might modify their program to adjust for that. If the patient...
Now, I'm sorry. Do you follow up with these patients personally, or what is the protocol normally?
Yeah, so typically my protocol is I'll have an initial consultation, which is gathering all this information from the patient, and then also working with them to create their individual goals. Because I feel like if they don't have their own goals in mind and they're just being flat out told what to do, it won't be as successful. And then based on that conversation, I create them a personalized program that they do from home or from a gym, whatever they have access to, because that's a major factor as well, is some patients don't have access to a gym. So I want them to feel successful and able to do the exercise they can do. And then I follow up with them after reviewing that program with them every 4 weeks to start.
Oh, okay, that's good, because that's a very important factor, the follow through and follow up, because these patients they may not even remember. They are tired a little bit. So I think a proactive follow through from your side is definitely a plus point, because they are more than likely to listen to you. They may not listen to anybody in the family, in their family members, but they're more than likely to listen to the third party. And I think that's very helpful. How do you approach the exercise planning? I know you mentioned that you take their profile up front, but especially when patients are undergoing chemo or recovering from surgery.
So typically with surgery, if there's anything immediate in terms of, if they've had a mastectomy, they will likely see a physical therapist first. So the physical therapist will work on those immediate concerns with gaining strength back or only doing exercises that are appropriate to not cause additional harm. So I usually get permission or clearance from the surgeons for when they're ready to do general exercise or lift heavier weights, things like that. And then from there, I take into consideration their treatment. So for instance, if they're undergoing chemotherapy, one of the more common ones is they might have chemo every 2 weeks. And so depending on the patient, some of their side effects might be, make it difficult to exercise in that initial 1 to 5 days post-treatment. So in that case, I might recommend, let's just do what you can. If you can get out for short, light walks, that's fantastic. And then in that second week, try to encourage them to do a little bit more.
Okay. Is there a tracking device that you have that they're able to record that information and then you can see it, or how is that working out?
Not at this point. We've kind of been ongoing working on that. The research program does provide, depending on the study they're on, does provide various tracking devices. And they're kind of the ones collecting that really rigorous data.
Okay.
So hopefully we'll be able to collect some of that information as well.
Well, that'll be good if that happens.
Yeah,
that'll be
absolutely.
good. Yeah.
If the patient,
so for both of you, I'm sorry. Go ahead.
Oh, I was just going to say, I do ask the patients if they have any of their own tracking devices already, and some of them will send that to me.
Oh, okay. That's good. So for both of you, Cara and Kylie, can you share a success story or lesson learned from your experience?
So I would say not one specific success story, but I think what I, just love to hear from patients is, often these women, especially if they're older, being diagnosed, many of them have never exercised in their lives. And they don't even understand, that exercise can feel good. It's a very daunting, scary thing. So I think kind of hearing those patients that just grasp onto it and don't just feel the physical benefits, but also the emotional, the mental, the social benefits from exercise,
Absolutely.
and then they're kind of bought in, and then they're so motivated to continue because they feel good.
Well, that's the key, isn't it? Yeah. And you, Cara?
Yeah, I would echo the feeling when somebody, is eating a certain type of diet and they make some gradual changes over time. And then maybe after I've been working with them for 6 months or a year, they tell me they have much more energy. And oh, by the way, Cara, I no longer have to take my blood pressure medication. So they're getting benefits in terms of cancer care, but they're seeing whole person benefits too with healthy eating. And these are changes that can affect them over a lifetime, these types of diet modifications. This isn't something that's, a one and done. So they're seeing positive outcomes now, and that's going to stay with them and have a positive impact on so many levels.
Of course. What are some of the common myths, or I would say barriers, patients face when it comes to adopting these healthy lifestyle habits? And how do you help them overcome them?
One thing that I often hear is it's very time consuming to eat healthfully. I also hear that it can be very expensive to eat healthfully. And there's a kernel of truth in both of these. So there is a certain amount of time that needs to be put into preparing meals and creating healthy food environment.
Right.
But I do think that once people get on track and start doing this, it becomes habit and it doesn't feel like a burden. It just feels like part of the lifestyle. So we are all limited with our time. If we only had unlimited time for nutrition and exercise, but we really make the most of the time that we do have. The concerns about budget, I think I always love it when people realize that eating healthfully does not have to be expensive. And there are so many traditional types of diets and plant-based diets that can be very, very cost efficient and, that really don't require spending a lot on expensive foods. So that's something that often seems like a barrier at first, but we can often work through with appropriate resources.
Okay. And you provide them some kind of a counseling in that regards because they don't know how. And I think you always start with teeny bit, little bit, small steps towards achieving bigger goals, right? Sometimes we have a tendency of thinking the end goal first rather than looking at the initial step.
It's so true. It is so true. I spoke with a lovely woman this morning who I think was getting a little ahead of herself in terms of all of the things she wanted to accomplish. And, we ended up breaking it down into, all right, what are 3 goals that are takeaways that you can do just for right now before the next time we see each other in 6 weeks?
Right.
So those changes may be, not a complete 180. We don't expect that. They
Right.
can be incremental, and they often stick better that way when they are incremental.
Exactly. What advice do you guys give to the family? Because that support is so important,
Mhm.
and they have to play a very important role
Yes.
into the well-being of that individual. So, is there any guidance to the family members?
Sure. In the case of someone who is going through a treatment and they may be more fatigued or have less appetite, there is an emphasis on helping the people who are providing care, family, friends, etc., with assistance and
Yeah.
helping them to understand what the patient is feeling. So maybe not imposing their food preferences or values, but really working with what the patient is experiencing at the time, giving them options. There may be a scenario. I had a scenario this morning where I met with a couple, and the wife was recently diagnosed with breast cancer, and the
Right.
husband was talking about his food habits, and we really talked about how they, as a family, can make some healthy choices since one person is not just eating all by themselves in a vacuum. So we talked about some ways that diet changes really could impact both of them and improve their whole family's way of eating.
That's a good idea, because I think if one is not doing well in terms of eating habits, the other needs to adapt to that. And I think as a team they can.
Sure.
I had to change certain diets myself because of my wife. So, but anyway, how about you, Kylie?
I mean, just to kind of piggyback on what Cara was saying, it's so similar with exercise. So encouraging a family members, if they're able to, if I'm telling a patient to go or encouraging a patient to go for a walk, if they're able to join them, having that accountability buddy or family member, friend to go walk with is, makes such an impact on their consistency and actually following through. Absolutely.
Okay. No, I think that's important. From an exercise perspective also, you need a partner to walk with you, encourage them, especially when they're feeling down. How do you basically uplift them? And even 5-minute walk is better than 0-minute walk, So
Exactly.
can you each one of you share a moment or a patient story that really affirmed the value of integrative care in your work?
I would say, again, not so much one patient, but I think Cara and I probably communicate on a weekly basis about patients. And, I have a patient with exercise, I would say 9 out of 10 times, they're going to ask me about nutrition because, knowing that impact with both. So then we'll refer to the other,
Right.
and, and then we'll go back and forth like that. And so I think that's been really important. There's also the Integrative Medicine Center at MSK, and using them as a resource too. So patients, we'll talk to Cara about nutrition and supplements, but then there's also even people who specialize in supplements and sleep and acupuncture.
Right.
And I think just really educating patients on that whole care, whole body care.
So you said something and it triggered a thought. And when a patient walks into MSK or any cancer hospital, the integrative group is left behind. They don't get involved up front. It's a medical oncologist, but in their team, I don't see anybody from the integrative group coming in and being a part of that team. Is there anything that MSK is doing to kind of foster that, bring the integrative approach into that context?
I mean, ultimately, I think the Healthy Living program that we're working with is really trying to take that approach from the start,
I
like
know.
Cara said earlier. So they're, that's making huge strides there. And since some of the referrals from the Healthy Living program, they'll include us, they'll include the Integrative Medicine Center, social workers, nurses, patient to patient, support systems.
Okay.
So yeah, and hopefully, I think the ultimate goal is that this will expand throughout other departments in the hospital.
Well, that's what me and Neil, we are trying to work towards that objective. through our foundation that is supporting the activities with MSK to kind of bring that in the forefront, because I think the hybrid model of holistic treatment with the chemo is ideal combination, and I think that needs to be fostered more and more rather than just simply the chemo fact. I think the patients, I believe, they need help, they need guidance, they need where they can go. This morning, this 22-year-old woman got HER2 positive, and she's going through chemo, starting a chemo next week. And her father basically reached out to me and saying, I need to reach out to integrative group. I've heard about them, but I don't know how to get them, how to talk to them. So these questions that are coming up, people are becoming more knowledgeable about what's out there. And that's a good thing. Now, the second good thing can happen is that the integrative group becomes more proactive in terms of the starting point where the patient is coming in, and they become part of that team. So that would be very good. So for the listeners who may be newly diagnosed or supporting a loved one, what are one or two actions that they can take right now to begin incorporating these healthy practices? Each one of you can make some recommendations.
Sure, I can start with that. As Kylie said, people will ask both of us about the others' disciplines as well. So I do also encourage physical activity as medically appropriate and piggyback
Sure.
on what Kylie's working on with patients. So I'm just putting that in the forefront. I will encourage not just what shouldn't you eat, but what should you eat? What kinds of foods do we want to add in? And that might be increasing vegetables. It might be having more whole plant foods. It might be increasing fiber or hydration. These are all things I think we can all do. And that doesn't have to mean eating 17 different vegetables with every meal. It might just be looking for one place where they can add a little bit more whole plant fiber, for example. So that might be something to start with. Limiting alcohol is also something that I would start with. And I do find that people, even when they're able to reduce the amount of alcohol that they drink, often have health benefits that go beyond just minimizing the risk for cancer development and feel better too. So I think, focusing on what can I eat, what kinds of whole plant foods are going to be delicious and healthy for me, making sure you're getting hydration, limiting alcohol, and physical activity. And I'll leave that to you, Kylie.
Okay, Kylie.
And in terms of exercise, there's a lot out there that, in the media that always says we have to be working at our absolute maximal intensity, doing 5 highly vigorous spin classes a week in order to see any benefit or, see improvements. And that's just not the case. So I would encourage people to, even if you start with 5 to 10 minute walks, 3 times a week, and then the next week you create one of those, add 5 minutes, that's just as valuable. And those small increments are going to be really, really beneficial. So not getting caught up or, being intimidated by the long-term recommendations, but the slow build up towards that, so that those habits are more long lasting.
Right. And I think I think people are becoming a lot more aware of the yoga, meditation, exercising, cycling, better nutrition, plant-based diet. I mean, that's commonly that people are becoming a lot more aware. I think it's a discipline that they have to adapt to. But I think one of the biggest challenges that I realize is talking to some of these women is that they need to form a habit. They don't know. Forming a habit is simply said, but I think with what type of food they need to have. And I think that is something the guidance there has to be some kind of a guidance. They don't know. They will go to the vegetable market. They'll pick up the stuff. It's greens. Yeah, that's fine. But I think how they cook is also very important. And what type of oil they're using. Or these days I hear that ghee is better than oil. There is another, dialogue that is emerging in the marketplace. So there's a lot of confusion out there. That is, one finds something new and they'll broadcast that, and people will start following that. So how do you eliminate this confusion amongst these patients? Amongst these women?
I'm not sure it's possible to eliminate, but because more and more, and again, I've been doing this for about 18 years, and there's more misinformation and disinformation in the lay media than I've ever seen. So it's
I guess
really
it's
challenging.
easy to
Really
get
challenging.
misinformation.
Yeah, and someone can be very thoughtful and educated and still have a hard time discerning what information to keep and what they don't have to follow. So I think again, forming these habits and making practical changes may be different from the knowledge itself. So first, it's imparting the knowledge and making sure that people understand, for example, which types of foods may be most beneficial. But then, as you said, how do you put that into practice and how do you make that into a habit day in and day out? So it's the knowledge first, and then it is the practice. Yeah.
Yeah, exactly. Yeah. So I think what I gather from this conversation is, number one, exercise. Okay. Do your yoga if you can, and meditation you can. And as far as eating goes, plant-based diet is the best way to go forward. Avoid red meats, avoid alcohol, or minimize the intake of alcohol. So, I mean, you mentioned about the Mediterranean diet is quite healthy. So I think that's quite helpful for patients to take away from this podcast. So I think with that, I think we end our podcast. I want to thank both of you for your time, and hopefully, I'm hoping that patients will and the women will benefit, or anybody who has a family history of cancer can benefit from this podcast. So thank you again. And again, thank you, audience, for your support. We appreciate. And you're more than welcome to go to our website, alkaohri.org, and get more details. Thank you very much.